My face is like crooked. Do you see it? Admittedly, it feels like this whole area is kind of drawn up. I was expecting to sit in front of here and say how things were going in physical therapy because I just had my first session and I was just so confused when I sat here and my face looks different. And now I notice it. Like now I'm really seeing that this is coming up. Oh, it feels so weird though. Ignoring like that half of me and stuff, I did want to talk. I wanted to say how my physical therapy went and what I was going there for and how I'm feeling. I am feeling pretty good. This is the first time that I was seeing a physical therapist for a neurological condition, about the functional neurological disorder that I have. And so my it doesn't know how to talk to my nervous system very well. And my nervous system takes things very personally in life. It's like, oh, the sun is shining. Okay, time to malfunction. Oh, loud sound? Malfunction time. Oh, you tensed up and turned your head ever so slightly? I'm gonna malfunction now, okay? And it's frustrating because there are some times when I can do like lots of cardio and stuff, and I can do really awesome, good long yoga session and qigong, and I can do all three in one day and be fine. And then all of a sudden, my nervous system gets offended about something, and then I can't even do a sitting qigong practice. Just can't even do that. Any little thing that I do, or my body does to me, it overreacts. When I try to explain this to people, they tend to automatically assume it's because of anxiety. And yes, anxiety does cause it. Yes. And it's the nervous system. So anything having to do with anxiety affects the nervous system. And that's what the nervous system processes. So if you think of like a seizure is caused sometimes for some people by bright lights in succession. It overloads the nervous system. My nervous system gets overloaded by random little things and sometimes nothing. Like the lack of water or everything. Like honestly, any little thing can just be like a pebble in the pond and it causes a tsunami instead. And so yeah, it's anxiety. It is. My nervous system processes information and automatically assumes that I should be anxious about it. And that makes it seem like, it's something I should fix with therapy. And yes, you are true. You are right. You can use mind over matter in this. However, because it's a brain thing and it's a nervous system thing, malfunction, you also have to kind of work with the body. And that's what's really I appreciated about today. Because today I met physical therapist Amanda and her friend Christina. They apparently were talking about me when they were looking through my chart and everything before they met with me, and they were super excited. Super excited, and I really appreciated that they were excited. I haven't met anyone in the past 6 years. One doctor. I met one doctor, but besides that, no one was excited about me. They saw my symptoms and stuff, and they automatically made these assumptions and labels, and they knew what's best and stuff like that. But these girls, when they tried different techniques with me, and they saw the results, or it led to a different way, like even if it didn't help me, but it led a different way, they were like, oh, awesome, okay, cool. They were excited about the problem solving part of it. And they kept saying too how excited they were. And I'm like, oh my god, I'm excited now. Oh, it was really refreshing. It really was. I had such a good experience there. If we get down to the actual exercise that they did with me, we couldn't do a lot with me because we have to start from the very beginning. My nervous system takes everything personally. And so we have to like baby steps. I was having symptoms as well, which actually I think it really helped. Because when she had me do this one thing where I was laying on the table and all I had to do push my head into the table just to like activate that muscle. And it was just too much up in this area for me. It hurt. I was seeing sparks. And so then when I told them that, we had to pull back. And so like then instead of pushing it in too much, I just like pushed it in lightly. And I was still seeing colors and I was still having problems. And so then we decided, okay, don't push your head in. Just think about pushing your head in. Like just the simple act of thinking about the action. And so I did that, and my body was able to realize that there was no stimuli. It was relaxing. And in this whole technique, everything that we did today was called decompression therapy. And I'm going to do some more research on it because I don't know too much about it. It's really good for centering and getting your nervous system back in alignment, while also slightly toning your muscles enough that you can eventually get more stability in your time, in your life. This is how they described it to me. Get more stability and then be able to exercise on top of that and come back to that stability line, as opposed to, for me right now, my stability line is like down here when I should have it like maybe up here. And so anytime I exercise, it shoots me even lower. They also did leg lengthening. When they found that doing the pressure thing was too hard for me, like we did a shoulder one and we did the head one. When we found that that was too harsh on me, it was just too much, they decided to go into the lengthening techniques. And my right side was okay. It didn't hurt. It didn't cause me too many problems, at least like the arm one. When they pulled my leg, though, I stabilized by pushing my head in, and I caused like sparks and issues like that. So we had to do more of that initiation, so thinking that I was lengthening as opposed to actually lengthening, like just getting the brain on board first. And as far as like the leg, I had to do less, but I could activate the muscle. Like we were able to do like the least amount of activation with the muscle and breathing without causing symptoms. I am having problems right now, sorry. That's why I keep pushing this area. So after I got out of, there's the tender spot. After I got out of therapy, I felt so clear. Like my cognition was great. It was there. I wasn't feeling foggy. And I felt happier and lighter and less depressed for sure. Like I could tell that just those little exercises helped. I also felt that rising, like you feel this pull here, and I'm seeing it too, like it's higher, which is good. However, the muscle is so tight on my left side right now. I appreciated when they checked my muscles and they're like, man, yeah, your left side is really tight, the whole area. I'm like, I know. But I'm looking forward to this. I think this is a good idea. I think good things are going to come out of this. So yay life. L'chaim. I'm excited to have shared this with y'all because this is the year, and I know I mentioned it in my last video, this is the year I want to focus on my health and I want to focus on getting it up to par. Whether or not I can fully recover, I know something happened on this left side, and from everything I've read about the kind of spasticity that I'm experiencing, it doesn't seem like a full recovery is gonna happen, but I can definitely learn techniques and tools that can help me feel better. And I already know that improvement is possible because where I was 3 years ago compared to now is much different. I was so tight, like this hand came up, this foot was up on a pretty daily basis. And now I have moments where it just aches and it wants to come up, but I can like not let it. So that was physical therapy, decompression therapy with Sue's 101. It wasn't really a 101. It was just an update, health update. If anyone cares, I care. It's for my own recovery and finding what has helped me. So, whatevs. On that note, stay safe, stay strong, and stay tuned into yourself. And my mouth was doing this on its own. I'm kidding, it's not. Okay. Bye guys.